with the decline in external funding, we're looking at the national government to be able to increase the investment, put the investment into MS and transgender programming, but more importantly into the communities. But I think the levels of change will be too fast for governments to be able to pick that up. In Southeast Asia, only Thailand and Malaysia are able to put a lot of resources into their programs for MS and transgender populations. But even with their investment, it's still not enough. It's a very crucial time for funding for MS and transgender populations in our region, primarily because of the infection rates among these populations, and the levels of investment needs to be sustained, or else governments will need to increase their investment by 2020 when they can increase investment now. I think a lot too is primarily because of the stigma and discrimination, and there is a lack of political will to really tackle the needs of these vulnerable populations. As an example, in our region of 38 countries, 18 countries criminalizes same-sex sexual behavior. So I think that drives people underground. They are not able to access services that they need, and I think over 2/3 of people of access with men and transgender populations don't even know the HIV status, so they don't want to go and get their HIV tests. Because of stigma and discrimination, men and transgender populations are less likely to access services such as HIV testing. In our region, only about 1/3 know their HIV status, but whilst 2/3 people haven't been tested and don't know their HIV status. With political will, there is going to be significant investment and real multi-sectoral working together to ensure that the communities are at the heart of the response. So for us to reach the 000, we'll need to work together with the communities, especially the MSM and transgender communities. And we need, political leadership to say that these are our citizens of our countries, of our nation, and also deserve the rights that anybody in the nation deserve, and they need to be catered for. The rates of HIV infection amongst men and women who also are sex workers are higher than the female sex workers, and I think because they are more underground, and services are not being reached for condoms and lubricants. The male sex workers are more vulnerable to HIV infection because of the lack of access to condom and lubricants, and also that the multiple partner that they have to negotiate condom use with, and they are primarily from a lower socio-economic status than other men and cis men, especially the more gay identified populations. Male sex workers in Asia Pacific need to be able to access condom and lubricants, need to be able to access organizations that provide those services, need to be able to access voluntary counseling and testing for HIV when they need to without being coerced, and that their information will be kept confidential. What we need to do differently, as also a tagline for ICAAP this year, is investing in innovation, which means that we need to do things differently, being brave in our approach. The use of social media, for example, and it has to be brought into programming, and how do we leverage and utilize that for outreach? Because male sex workers, I think they change, might not be venue-based, where traditionally the peer outreach workers can go and meet, but now things happen online, and I think there is a lack of interventions online where maybe younger people are hooking up on the internet, on Facebook, and programs are not there to ensure that information on HIV, where to access services such as condom and lubricants can be accessed.